esteemed guests, dear colleagues and friends. It's an honor to speak with you today. The theme of your conference, to find African solutions and interventions to strengthen surgical systems, is so important. Surgery and anesthesia care saves lives and reduces disability from a range of conditions, from injury to cancer, infection to obstructed labor. But hundreds of millions of people around the world lack access to safe surgical care. In low and middle income countries, 9 out of 10 people cannot access even the most basic surgical services. You can change this. Surgical care is a highly effective and cost-effective intervention for some of the top contributors to the global burden of disease. Road traffic injury alone is the top killer globally among people aged 5 to 29. You can save many of these lives and many others. Whether you choose to do so as a nurse, a doctor, a public health specialist, or a researcher, you can confront this injustice and make the world a more equitable place. Everyone should have access to the high-quality surgical care they need. A strong health system rooted in primary health care is the foundation for achieving universal health coverage and the trust of communities. This must be supported by the availability of high-quality surgical emergency and critical care services and the financing mechanisms that ensure access to timely, safe, and affordable care. Yet, the global need for surgical and anesthesia services greatly outstrips their availability. This means that prompt and accurate referrals by primary care providers is especially important. Last year, the 72nd World Health Assembly passed a resolution calling on WHO and countries to ensure that timely access to surgical care is available everywhere. We must heed this call together. WHO takes a health systems approach to safe surgical care and is supporting countries to strengthen systems so that patients can get the surgical care they need when they need it. WHO has dedicated programs on surgery and emergency and trauma care within its clinical services and systems unit. We offer a range of practical assessment, training, and data analysis tools to support the delivery, monitoring, and evaluation of surgical care. These include checklists, case-based registries, training courses, advocacy materials, planning frameworks, and facility and national level assessment tools. I will leave you with 3 requests. First, even as you study the practical application of surgical care, make sure you understand how surgical and anesthesia care fit into health system in which you work. Second, for every life you affect as a clinician, you can also impact countless others by engaging with policy makers, raising public awareness, and building an evidence base around best practices. Third, as students, you can engage beyond your clinical roles and act as advocates and researchers for improving access to health systems and the delivery of surgical care. Thank you all for your commitment to serving others with your skills and training. You are the future of global health, and it will be on your watch that access to timely, safe, and high-quality surgical care is improved. WHO is with you. I thank you.